Welcome to the live checkup. This is where we sit down with Dr. Asante LeBlanc and ask all the possible questions we can when it comes to our health and care. Let me just tell you this first off. Dr. Asante LeBlanc is the medical director and owner of Victoria Clinic, your home for holistic health care in Trinidad and Tobago. Victoria Clinic is located at 54 Galley Street in Woodbrook. Dr. LeBlanc is a medical doctor and certified medical herbalist. She is an integrative health care practitioner, bringing together the Eastern and Western branches of medicine so as to better guide patients on their path to optimum health. She's also a certified clinical densitometrist, specialist in diagnosis and treatment of osteoporosis. At Victoria Clinic, services offered include medical consultations, traditional Chinese medicine consultations, acupuncture, medical herbalism, blood tests, electrocardiograms, lung function testing, and Dexter bone density testing. You can contact Victoria Clinic at 622-2221 or 622-0683. Follow them on Facebook, Victoria Clinic, or Instagram, Victoria Clinic _Trinidad. Website www.victoria-clinic.net. This is the live checkup. I'm JD. Now, let's jump into today's conversation. Hello, guys, and welcome back to another episode of the live checkup. I am JD, and it is so good to be inside of your world, but I cannot do the live checkup on my own. Of course, as always, for what has been maybe 2.5 years, I've been doing it with the doc, Dr. Asante LeBlanc from Victoria Clinic. Of course, you would have gotten all the details in the intro earlier on about Dr. Asante LeBlanc and the clinic, its location, and what you can certainly get there in terms of services. So we will certainly encourage you to check that out. Don't forget as well, when it comes to this platform, we encourage you to click like, share, and subscribe as well. Let's increase the family inside of the live checkup. How are you, Dr. Asante LeBlanc? How are you doing?
I'm good. Good night. Good night. Good day. Good day. Good day.
You look bright. You look, usually I know you've had such those powerful days that somewhere around 9 o'clock, I like to tell your business, you get very tired. So it's good to see.
I'm only human. What can I say?
Of course, understood. That's why I said, because of the length of your day, especially living in this pandemic, I can only imagine what your schedule looks like. So
no, I don't think you can.
We do appreciate your time inside of the live checkup. Yes.
My pleasure. Hi, everyone.
So we must say a special good evening to Gina, because she's one of the followers and onlookers of this program for the past few years in terms of listening, because Gina is visually impaired, I should say that. But one of the things she's always been saying, Jay, you guys need to talk about vertigo, because this is something that she deals with ever so often, because it seems to be something that comes and goes. We'll find out more about that. But finally, we're sitting here with the doc to discuss vertigo. Woo! Dr. Asante LeBlanc, it feels like I've been asking you forever, man.
Gina sent me back to school.
She did. The joys, right? The joys. So it is so good to certainly dive inside this topic. I've heard about it. I honestly, Dr. LeBlanc, I'm not sure if I have ever experienced it, but sometimes you do get that sort of just a short dizzy spell kind of thing. So because I'm not too sure what it is, let's start off with the most pertinent question. What is vertigo? What is that? What's happening?
I like how you say that, how you get a dizzy spell, because vertigo is a type of dizziness.
Right.
So dizziness is where, so there's a difference between dizziness and vertigo. So dizziness is where we feel this lightheadedness, off balance, like we get up too fast, just not feeling right in the head kind of thing. Whereas vertigo is where we feel an actual rotation, spinning movement, even though we are stationary. So we could be lying down and we turn to one side and we feel the room spinning.
Right.
Or, so, and it may or may not be associated with some ringing in the ears or stuff like that, or other symptoms. Now, vertigo in itself can be either peripheral or central, right?
Oh.
And vertigo mostly has to do with your inner ear. So our ear has an outer, middle, and inner ear
Mm-hmm.
portion. And
Mm-hmm.
the inner ear has what we call semicircular canals. So all of that maintains our balance, so to speak.
Right.
So we have a nerve called cranial nerve 8, or the vestibular cochlear nerve, and that nerve helps us with hearing and with balance, right? But balance is made up of your vestibular system, your ligaments in your feet,
Right.
right? Your cerebellum, which is a piece of the brain at the back, posteriorly, a part of your brain, and your eyesight, right?
Okay.
So that, because what happens is our body is rectified and kept on balance based on all little micro communications in split milliseconds to keep you straight. So when our vestibular system has a problem, so sometimes there's a difference in pressure, or there's a difference in the circulation of the lymph, the endolymph and the perilymph in that system, or the crystals, because there are crystals in that little micro system.
Oh.
So they're different little things. So that's why Gina had me bracing for a while. So those can cause vertigo, which is a feeling of spinning, even though you're stationary, right? So it's important to understand that aspect of it. So a
So,
patient,
so there are many
uh-huh,
contributing factors to vertigo.
possible contributing factors. So when a patient comes into us and says, I'm feeling dizzy, we have to ask the patient, are you feeling the world spinning around you? Or are you spinning around the world even though you're stable? Or is it that when you get up too fast, you're feeling just lightheaded and a little bit and it lasts a few seconds and goes? Or when you move your head too fast, you just feel lightheaded and then it goes? Or are you moving your head and then feeling like you're spinning and
Right.
like you're not stopping? And are you losing, like feeling like you want to faint? Do you feel like you want to drop down? We call syncope. Are you feeling any other symptoms? So that's when we have to determine as physicians, is it dizziness or vertigo? Then we have to figure out if it's peripheral, meaning like an ear infection. There's a disease called Meniere's disease, where there's an imbalance of the liquid in the semicircular canals. Those TMJ sometimes can have with it vertigo because of a lot of facial contraction. Those are peripheral causes. And like a vestibulonitis, which is an inflammation of the vestibular system. But then we go on to the central causes of vertigo, which include such things as brain tumors,
Oh.
acoustic neuromas, which are tumors of the acoustic nerve itself, the vestibular cochlear nerve. So central issues within the brain, cerebellar ataxias, sometimes a stroke of the cerebellum can cause a feeling of vertigo. So vertigo is quite daunting in
We can
in
tell.
in
Yeah.
presentation to both the physician and the patient, and it's also quite annoying in terms of treatment, especially
So,
peripheral vertigo and
so,
dizziness.
so that's where I was going to go next. How do you stop it? And that, I guess, that is tied into the treatment of it. How do we deal with it?
So I also forgot to mention that there are
Sure.
some drugs that are ototoxic or toxic to the vestibular system, antibiotics and other drugs, and so they may bring on vertigo.
Right. Okay.
Vertigo, you can have what we call benign paroxysmal positional vertigo. So that's called BPPV. That's also a big cause of peripheral vertigo. And so why I say all of this, JD, is that when you start off with whatever feeling, be it lightheadedness, be it rotational spinning, or whatever you're feeling, you do have to go to a physician, because you have to rule out that there's no central cause. There is no stroke happening. There is no tumor. There's nothing that is
Wow.
causing these symptoms, because this can be a symptom of something bigger. So it's important to rule it out. So it has to be worked up by a physician who will ask certain pertinent questions. And then we would take it from there in terms of determining treatment, right?
So before treatment,
So
then, so when I come, let's say the person comes to you and we have that conversation, what sort of, how do you test to see what it is? What is the
right. So when we come in, we ask certain questions. So did you get any head trauma, any recent infections, ear infections or otherwise, any new medication or drugs or supplements have been used? Any new exercises? Did you get in a motor vehicle accident? Did you have any whiplash, concussion, any kind of airbag issue?
Right.
um was Is there any hypertension? What is your past medical history? We go through all of that. We have to get a good picture of what is happening, because it's a very indescribable kind of, like, it's a symptom that can be mirrored or brought on by many
Many,
things.
many. Yeah, yeah.
Right. And so then after we go through that and we figure out do you have ringing in your ears, when did it start, have you had this before, all these questions have to be asked. And then we do the physical exam. So we rule out, we look at the cranial nerve 8. So there's certain maneuvers that we do to see how that nerve is functioning, to see how you're doing. And then based on that, we decide, do we need to do blood tests? Do we need to do imaging, such as a CT scan or MRI of the brain,
Oh, those are the things.
um, and other things like that. And then from there, we decide upon treatment.
Okay, so CT scan and imaging, that's one of the ways in terms
And
of,
some
and blood
right
tests.
and right, which sometimes we do just as confirmation that there is nothing centrally that is causing that, and therefore it is just vertigo, peripheral vertigo, and therefore that's treated symptomatically, with different in different ways.
All right, so we're talking about vertigo, finding, dissecting it as best as we can with Dr. Santé Leblanc inside of the live checkup. If you have any questions, please don't hesitate. Just jump on and put those questions there. Comments, we accept that as well. And thank you so much for looking on at us. You just was, as I mentioned before, let's talk about those treatments, because we talked about how the testing can be done. But what are the treatments for? How do you stop it? How do we work on this?
So treatments can include medication. So sometimes, for example, with Meniere's disease and just infections of the inner ear, we would do certain antibiotics, some steroids sometimes. We may do some of the medication for dizziness and vertigo, such as Stamatil and the others that everyone knows.
Mm-hmm.
Um, then after that, acupuncture also helps. There are maneuvers that we can do sometimes that help with vertigo, and really and truly monitoring blood pressure, blood sugar. But there's no, JD, and this is important, that vertigo may or may not be cured. Yeah, but you may have crises of vertigo, especially BPPV. But we have medication, we have maneuvers, acupuncture, cupping, different things that can help with it. From a Chinese perspective, when we look at things like vertigo and dizziness, we look at it in terms of a syndrome, and we ask certain questions. And based on that, there are herbs as well
Right.
that we can use along with acupuncture to help with, to support the vestibulocochlear system.
So all those big words there, but I hear you. We get it.
Gina asked for it.
I
She
know.
got it. So the
Woo!
vestibulocochlear system is your inner ear. It's your inner ear, and it's responsible for. So our hearing is tied to a nerve that is called the vestibulocochlear nerve. So vestibular means for balance, cochlear means for hearing. So it's the same nerve, and it has two branches, one for
Right.
hearing and one for balance. And it's just
Wow.
little canals, and they have liquid in them. Like they have different angles. So it's 3 rings, 3 canals, and they have liquid running in them and around them, and they have crystals. And those, the movement of that liquid and crystals then transmits to the nerve, and then lets the body know what position it needs to be in and what's happening.
Isn't
So,
it
so if that gets
amazing?
deranged, then
Isn't
you
it?
get
Isn't it amazing how the body really works? Think about it. Again, to the creator, thank you, because this is an amazing temple that we're in. Just thinking about water here, and this tells this. Wow, that's crazy. I say this too because I've jumped on to Lenox Hill. This is a documentary on a particular hospital in the US, and that, I don't know if you know it, Asante, but that documentary is just crazy when you look at a lot of neurosurgeons and you look at what they have to do dealing with that. I've been binging for the past few days. But you said that
oh,
many,
I don't know about it.
it's on Netflix, so check it out, Lenox Hill.
Okay.
So you spoke about some maneuvering. And one of the things that I hear from like Gina when she speaks about like when she gets that bout of it, she says she has to sit down slowly and just kind of wait for it to subside in some way. Or even sometimes if I call what you up to, she's laying down because it's happening again. Are there any other maneuvers that we need to try to not, obviously it won't get rid of it, but just help you through the process of dealing with it?
It really depends on what the cause of it is. And
Again.
so it's best for the doctor to do the maneuver in the office. But it really depends on the cause of the vertigo. To
So
be
if some
very honest, vertigo is a very, very niggling symptom.
I now see why you were kind of backing away from it. But if someone has that attack at home or that bout at home, what can you speak to them? What can you tell them to
if
do?
they've never if they've
And I've
never
never.
had it,
Hmm.
then they need to go straight to the hospital, because you have to rule out it's not a stroke, it's not a hemorrhage,
Right.
it's nothing, or space occupying lesion, nothing like that. That needs to be ruled out. So there are medical emergencies that need to be ruled out. Low
Right.
blood sugar, high blood pressure, low blood pressure, bleeding from somewhere that's causing that. So there's certain medical emergencies. So it's always best to go to a doctor if that's your first time. If it's been worked up and you determine that it is vertigo, then the doctor and you would work out a plan on what should be done. I
Okay.
mean, that's the best way for me to say it, to be very
Right.
honest, because there's nothing I would want somebody to try at home without seeing a doctor and working out a plan with their doctor in this case, really and truly. Because when it comes to vertigo, that brain, you see, when that
Mm.
brain is affected, you want to make sure that it's not the brain that's causing that symptom.
So then, the usual question that I want to ask as we get ready to wrap up this conversation, you're known as Dr. Ginger. So you're saying
Yeah,
there
ginger
may
wouldn't
not.
be.
Yeah.
Ginger is not my go-to for vertigo. There are herbs that we use.
Good.
Again, in Chinese medicine, when we look at a symptom such as vertigo, we don't see it just as vertigo. So what it is one of our questions is, in the TCM diagnosis, is there any dizziness? So as we work it up, we would tend to see what the pattern is. And then based on the pattern, we can add different herbs, because usually dizziness or vertigo is related to what we call liver yang rising. And therefore, when we see that, we know we have to look at the liver meridian and treat the liver meridian accordingly. And so there are herbs that we can use for that. And I really would recommend no home remedy herbs for that. I would say that has to be worked up,
By
and
your
then we
doctor.
determine what herbs. But there are herbs that I do recommend to support and help. One is Tien Ma, Feverfew. Sometimes I make formulas with Tien Ma, Feverfew. Depending on the pattern that you see, you make a customized formula for that.
And those names sound foreign to me. Are those
Chinese. So what
Chinese?
Tianma is a Chinese herb. Feverfew is a Western herb. I can't remember the scientific name of feverfew. Um, and then I use some formulas as well, some liver formulas, Chinese patented formulas, and Western patented, well, not Western patent, but mostly Chinese patented formulas, to be very honest, when it comes to vertigo and dizziness. But I also like to use acupuncture. And acupuncture can help, or it can also make it worse sometimes. So it
Wow.
depends. It depends on what is being seen, and it really is a work in progress. It's not a one-stop cure. It's really not an easy symptom, I must say. It's and with, for example, JD, with the Sahara dust,
Hmm.
which we're facing, a lot of us are more stuffy and the oxygenation of
Yes.
the brain is decreased, and then we get dizziness. But then it may turn out to be vertigo because of the inequilibrium in our air, and therefore the eustachian tube is not able to
Whew.
balance as much. So we feel what is dizziness or maybe vertigo. Sometimes as we get younger, we have degeneration of our spine in our neck, a cervical spine, and that clamps down on our major carotids that are going up to the brain. And so if it clamps down, when we move our head, it clamps down on the carotid and the blood doesn't go up. So the brain goes, yo, I can't get oxygen. So you feel lightheaded or dizzy. So there's so much. When you see dizziness and vertigo, that is one symptom and sign that I recommend you go to your doctor, get worked
Must.
up properly, and make sure that any central causes are ruled out.
All right. So even though it was a very challenging, oh no, I shouldn't say challenging, even though it was one of those discussions that took you back to med school and, had you opening all the thousands of books that you guys look at, it is indeed a shorter conversation because basically at the end of the day, what I'm taking from this, have that conversation with your GP. If you feel something, go straight to the hospital. So it is, even though it's not talked about consistently, it seems very serious as well because you've
And
got
it's
the inter
common.
and it's
Yeah.
common.
And it's common. And I think it's important to recognize that there's also an emotional component. Sometimes when people have anxiety, they term it dizziness or vertigo during
Yeah.
a crisis and a panic
Yeah.
attack, and it's not. So it's a lot about terminology, and we have to break down as physicians what it is you're really feeling to know how to work you up. So it's not something that we hate to deal with, but it's quite challenging
Yeah.
because
Yeah.
remember when somebody's in front of you and they're saying, "Oh God, I feel like the world is spinning and I'm nauseous and vomiting," and you're immediately thinking, "Oh my Lord, this has to be worked up. We have to rule out that there's not a stroke happening." So the big medical emergencies have to be ruled out. If we've
First.
established the cause of that symptom and why you're feeling that, then great. A plan can be made with your physician and we move ahead and work on that. But definitely, definitely don't um
One of the final questions before I wrap up. Is it, should I be extremely concerned? And this is a general question. Should one be extremely concerned if they find and they've seen the doctor, they're having conversations, but the bouts are too often? Is that
yes.
alarming?
So yeah, it's alarming and you need to be checked up and see if there's any
Again,
change or yes. For
yeah.
sure.
All right, cool.
Yeah.
All right. Well, as always, thank you so much for your time, Dr. Asante LeBlanc. Do you want to just give them a little sneak peek of the things we've been working on? We're working on something, guys, but we can't tell you much about it. But
So
it's
yeah,
you go
JD,
ahead.
you say, you go ahead, you do it. You do
No,
it better than me.
I'm. It's just simply that we're working on getting a larger audience and taking the live checkup certainly across a few more platforms to have yourself as well as so many other people you love involved in the discussion of the live checkup. Because trust me, I've known Dr. Santi Leblanc for some years. I don't want to put the number because that gives an age, but it's good to have a GP that can explain things to you. Now, trust me, I'm not the healthiest person in the world, and Dr. LeBlanc knows that. But it's good to be able to have those conversations where I understand what she's speaking about, or I know how to make those changes because it's simply it's explained easily. So the live checkup. Of course, we created this about 3 years ago. 2.5 years ago, even though we had conversations on a radio program before similar to that, we suddenly put our heads together and say we had to bring this to this platform. And now we want to see if we can take it to other platforms. Maybe there's a podcast
Yeah.
in the future. You never know.
Who knows? And we really just, I mean, I think it's important, JD, to understand that we're both trying to let our audience know that as a GP, so things to arm you with what you need to go to a GP with, to
Yes.
break it down to you. So a GP is not a specialist, but a GP is basically a jack of all trades. And a GP is the one who knows you, understands you, and then will send you on to a specialist if needs be. And so it's important for us to just debunk some myths, get rid of the fears, and help guide you towards that healthier lifestyle, which is the goal of Victoria Clinic, the goal of JD. And I mean, I would do this with no one else.
I appreciate that.
And we're excited. I think we're both
Yeah,
reached a
same here.
point where we're excited to see where this can take us, and not forget where we're coming from and
Mhm.
always remain grounded. So I'm quite excited. So
I am
look
as
out,
well.
look
So
out. We hope not to take too much of a hiatus while we're doing things, but you'll be shocked when we come with what we come with, I hope.
yeah, and still put those questions forward. We're not saying because you
Yes.
see a little 2 week break or something that we're gone. No,
No,
put
and
the
we're
questions
still
forward.
doing the live checkup
Yeah,
here. And then when we make any changes, you'll know, but we're not leaving this platform, but it's
yes,
just
yeah.
fun
Which add
things, fun
fun things.
things.
So thank you so much for always checking us out. I thank you as well for sharing this with your friends and your family. It's just information for us all. And thank you, a special thank you this evening to Gina
Gina,
for
for making me remember why I'm a doctor. Gina. Thank you,
All right.
Gina. Gina, I pushed, but you didn't let up, boy. And
No,
so
she
I
was
think we have
persistent.
another person sent you a very long WhatsApp, I
Yeah.
think on endometriosis or PCOS or
Yes.
that realm
Yes.
of gynecological issues. So I think
Yes.
we'll have to do that in segments as well,
Yeah.
so that you're not lost in all of what could happen. So that could be our next jaunt. And I like that actually.
Yeah.
That's
I could never say the word, but I just say, Doc, you know that E word?
and
Endio.
yes,
There. Yeah.
endometriosis. So we'll be here.
Endometriosis. There you go. I got it. So thank you so much, and God bless you all. Thank you, Doc. All the best to you. Be safe out there. We're all living through this pandemic, and I know it's important to continue to do what you need to do for us as well. Thank you.
Thank you. Blessings. Have a good one.
Take
Bye
care.
bye.
Bye,
See you
guys.
later.
And that's it. Another episode of The Live Checkup with Dr. Asante LeBlanc. This is where I say to you, thank you for your time. Thank you for listening. Thank you for the questions as well. You help me do my job even easier. And of course, it's always good to have Dr. Asante inside of our world virtually discussing some of the very important topics pertaining to our health. Now, if you've got that topic for a health discussion with Dr. Asante LeBlanc, don't hesitate to connect with us. In fact, send that email to jdsocial868@mail.com. Yeah, and we'll certainly put our heads together and bring forward another one of the episodes with you in mind. So don't forget, jdsocial868@mail.com. Check out my website as well if you're looking for any voiceover talent or maybe a host for an event, whatever it may be. Check it out, www.jdmedia868.com.